Good morning. I'm Dr. Rahul Kumar Chaudhary. I'm a surgical oncologist at Big Apollo Spectra Hospital, Agamkuwa, Patna. Women are usually the backbone in every family, be it as a mother, as a daughter, as a wife, as a sister. They're usually the center of the universe in any family. Women inherently care, and a lot of women spend all their lives taking care of people, and very often we see that nobody is actually there to take care of them when they fall ill. On this International Women's Day, if we are able to sensitize and make our women aware that about certain cancers which are increasing in incidence, we will have played a small part. Breast cancer has overtaken all cancers to become the most common cancer in the country. Breast cancer is almost exclusively a women's cancer, and breast cancer screening in the form of annual mammography after the age of 40 or a clinical examination after the age of 35 goes a long way in decreasing the risk of picking up breast cancers early. And as you know that if cancer is picked up early, the treatment results are very good, and many patients are cured completely. The other most common cancer is cervical cancer. In fact, out of the most common cancers in the country, breast cancer and cervical cancer occur in women. So cervical cancer is quite common, and it presents as white discharge per vagina. And cervical cancer goes through a stage wherein it is precancerous for some time, and then gradually it turns into a carcinoma. So if you are able to pick up these precancerous lesions or even early cervical cancer, the results of the treatment are very good. So annual pap smear examination is recommended for women above 40. You can contact your gynecologist or your cancer specialist for the same as to how it is done. It is just a 5-minute test. So the other cancers that occur in women are ovarian cancer and cancer of endometrium, that is the uterus. So cancer of uterus is not that common in our part of the world, and it presents as postmenopausal vaginal bleeding. The incidence can be decreased by lifestyle changes essentially. So all we can do is, if we have these symptoms, we approach a doctor very early. The other common cancer in women is ovarian cancer. Ovarian cancer, the presentation of ovarian cancer is very vague. The risk of ovarian cancer is more if you have a family member who has suffered from breast cancer or ovarian cancer. Ovarian cancer presents as painless, progressive distension of the abdomen. The abdomen bloats, swells, or you can have a lumpy feel, like you can feel a lump rising from the abdomen. So, but then usually these signs are late. There are no as such measures of screening for ovarian cancer. So the four common cancers we've discussed, the common cancers in women, and the other thing is for cervical cancer, we also have a cervical cancer vaccine. So if your daughter is more than 15 and before her marriage, you can give her the vaccine. Cervical cancer vaccine targets the human papilloma virus. The virus is known to cause cervical cancer. commonly, which it is the most common cause of cervical cancer. So if we target the virus, then the incidence of cervical cancer will come down significantly. So thank you, and happy Women's Day.